Hi, my name is Saj Rambab. I'm one of the respiratory therapists at Moreland Health.
And I'm Ed Birnbaum, another respiratory therapist with Moreland Health, home-based pulmonary rehabilitation program.
So the topic today for Breathe Better 101 is why pulmonary rehab. And again, it's part of the Pulmonary Rehab educational series with Moreland Health. And please go to morelandhealth.com for more information. What is pulmonary rehab? So pulmonary rehab, according to the American Association for Cardiovascular Rehab, I know that's a mouthful, but we call it the AACVPR, is a comprehensive program for individuals with chronic respiratory conditions that include exercise, education, and self-management training. So all of these three are very, very important and they go hand in hand. Um, but I also like to put a little bit of extra emphasis on the education component because we educate during exercise and about exercise. We do education more didactic, so like lectures and training classes. And then with the self-management point, we educate on that as well. So education is the common thread through all of it because the more information you have, the better you are equipped to take ownership of your health. And then these services may be provided by a variety of medical professionals, including respiratory therapists, exercise physiologists, and others.
Exactly right.
So some of the benefits of pulmonary rehab, we've listed them here and we'll go over it in more detail in the next slides. So pulmonary rehab helps people with chronic lung diseases with managing their symptoms and improving their overall quality of life. So here we have shortness of breath and respiratory distress. We have fatigue, we have deconditioning, loss of mobility, anxiety and depression, social isolation, and declining quality of life. So, also the declining quality of life, we talk about activities of daily living. So, all of these are things that can be improved from pulmonary rehab. Some people get more benefits from certain categories than others, and some people have more needs in different categories as others.
Right, right.
So, benefits of pulmonary rehab, what does the research tell us? So, pulmonary rehab, and we've abbreviated as PR, we're in the biz and we got to put some abbreviations in there. PR significantly reduces hospitalizations, ER visits, and doctor visits for patients with COPD. And there's a study findings for reductions in both hospital and ER visits ranged from 40 to 80%. And the benefits of pulmonary rehab are not limited to just COPD related hospitalizations and ER visits. Pulmonary rehab generally reduces utilization of healthcare resources by COPD patients for all causes. So the information and the education that you get from pulmonary rehab can help all facets and phases of your health. Many of the benefits of pulmonary rehab seem to persist. So a study from 2021 evaluating its usefulness to repeat pulmonary rehab found that COPD patients continue to experience lower healthcare resource utilization for several years following a single course of pulmonary rehab. So the benefit that you get from completing one full pulmonary rehab course definitely benefits you for the rest of your life because you get that knowledge and that information and you can use it and continue to use it and refer to it over and over again. Now, home-based virtual pulmonary rehab is at least as effective as conventional center-based or gym-based pulmonary rehab. This has been a consistent finding, with some studies even suggesting that home-based pulmonary rehab may deliver more durable outcomes because people don't have to travel. There's less involved in getting to a gym-based or a center-based program, less coordination. You can do it in the comfort of your own home. It does get a little bit more solidified in that manner when you're doing it from home, and there's not as much hassle around attending the program it is getting to a center-based program. And pulmonary rehab slows the decline. So pulmonary rehab teaches patients how to avoid and or mitigate exacerbations or flare-ups, which have cumulative effects on lung function over time.
Right. And the more we've looked at, we, the experts, more research that's been done on the benefits of pulmonary rehab shows every time they look at it again and they look at it more, that they find more reasons why it's good for people with chronic lung disease.
So, who can benefit from pulmonary rehab? So, recommended and considered the standard of care for individuals with chronic lung conditions. So, there's chronic obstructive pulmonary disease or COPD, fibrotic interstitial lung disease, pulmonary hypertension, and preparation for or recovery from a lung transplant. So, that is the lion's share of the patients that we see in pulmonary rehab, whether it's center based or virtual. COPD being really the number one diagnosis. But it's also been shown to benefit patients with a variety of other conditions, so cystic fibrosis, bronchiectasis, restrictive wall disease, asthma, lung cancer, and preparation for or recovery from chest surgery. So again, I can't stress enough that the education and the information that you receive from a pulmonary rehab program can be used to help all different facets of your health. Exercise is always a good thing. Learning how to breathe effectively, and the more information you have about maintaining health, your disease process, and how to gain more function back, whether it's physical or psychosocial function back, is always better for your overall health. So exercising is a core part of pulmonary rehab. So deconditioning is a significant factor driving the downward spiral of individuals with chronic lung disease. So weakness and shortness of breath make you do less, and doing less makes you weaker and even more short of breath. And it really is a bit of a downward spiral. You know, they feed off of each other. So we're trying to break that cycle. And pulmonary rehab helps to turn the declining downward spiral into a virtuous circle. So it's going to take you up instead of going back down. So being stronger and less short of breath lets you do more, and doing more helps you get stronger and further reduces shortness of breath. And it's slow and easy wins the race. And that's what pulmonary rehab helps patients learn and practice over the course of the program.
That's right. And there isn't really much other way to turn that downward spiral into a virtuous one. Um, Not intervening at all, just, saying, just, I'm sure every physician, of course, will say to somebody, try to exercise. Well, if you're short of breath all the time, you might take that advice seriously, but it's really, really hard to do on your own. It's so important to have someone that can give you that ongoing encouragement and show you exactly how to get exercising. Even people, I mean, if you think about how everybody thinks they ought to exercise and how many people really do, it's only a minority because it's so easy not to, and you have to know how to get started and have somebody there getting you started, and all the more so with chronic lung disease. And that's what pulmonary one of the things that pulmonary rehab can do for you.
And then education is essential to getting the most out of pulmonary rehab. And the more you learn about your chronic lung disease and how it impacts your well-being and ability to do things, you learn more about your medications and how to use them effectively, and you gain confidence. And that education you can apply again to other things in your life and in your overall health journey.
Right, right. Knowledge is power, and
Yeah.
it just always helps.
Pulmonary rehab teaches how to better manage chronic lung disease. So you have chronic lung disease every day at home, not just when you show up to the clinic or to the ER or to the hospital. So you learn how to more effectively use your medications and other tools, oxygen, lung clearing techniques, etc., and learn how to manage symptoms better every day at home and have a plan for taking effective action when symptoms change. And all this is part of pulmonary rehab, and we dive much deeper into them in our education topics and then over our one-on-ones.
Right. We call them providers. There's more than just physicians, of course, nurse practitioners, so on. And many of them do give good education, but they don't have much time and they don't really have the facilities. Insurance doesn't pay them to do this. They have so much they've got to get done in the amount of time they have. An appointment might be 20 minutes, might be 30. or even less. Um, so really, you need a program specifically designed to do that, and pulmonary rehab is such a program.
So it's personalized to meet your unique goals. So first step is you're referred by your provider who knows you. Then we do a personal assessment of your abilities and your needs. And then a program is designed with your input to help you reach your personal goals. We want to make sure that you have, a program that's really custom tailored to what your needs are, whether it is, you want to be able to go up and down the stairs more easily, or take a trip somewhere. We're going to try to help you get the tools to get to that goal, and make sure that we meet your unique needs.
Right.
Programs vary in length from 8 to 12 weeks. Patients will typically have appointments from 1 to 3 days a week. Programs may be either hospital-based or clinic-based, sometimes in gyms. Covered by Medicare for patients with COPD, as well as other chronic respiratory conditions, up to 36 visits, but may be extended up to 72 visits. Moreland Health's home-based pulmonary rehab program is 100% virtual, designed for patients to participate from the comfort of home. Duration is typically 8 weeks, but may be customized to meet patients' individual needs. Patients meet weekly, twice a week, in small group classes for exercise, education, and discussion. Patients also meet individually with a respiratory therapist at regular intervals for individualized one-to-one counseling and progress assessments.